Welcome to my channel, BodyTalk. What are joints? The points where two or more bones meet are called joints. Joints include your hips, knees, knuckles, elbows, and shoulders. There are joints in your spine as well. However, joints are not just bones. They consist of the soft tissues that surround them, including ligaments, tendons, and cartilage. The hard, slick, flexible substance that covers your bones' ends at joints is called cartilage. Tendons are strong, pliable bands that allow you to move your joints by joining your muscles to your bones. To maintain stability when you move ligaments, hold the joints' bones together. Joint disorders. What are they? Diseases or injuries that impact your joints are known as joint disorders. Overuse of a joint can result in injuries. You might sustain an injury unexpectedly, like an accident, or a sports injury. Which conditions can impact the joints? The joints can be impacted by numerous illnesses. They frequently result in stiff, red, or swollen joints and joint pain. The majority of them are chronic. They are therefore lasting. Some might never entirely disappear. The following are a few conditions that impact the joints. Arthritis. Joint pain and swelling are possible symptoms of arthritis. There are numerous varieties of this illness. The most prevalent kind is osteoarthritis. Arthritis can seriously harm joints over time. People of various ages may be impacted. Later in life, osteoarthritis may result from a joint injury sustained. As a child, lupus, this autoimmune condition, can cause joint and muscular discomfort and affects numerous regions of the body. Arthritis is frequently caused by some forms of lupus, the syndrome of Sjögren. Many glands in the body that produce moisture are impacted by this autoimmune condition. Dry mouth and eyes are the primary symptoms. However, joint discomfort is also frequently experienced. Depending on the condition, different treatments are used. To alleviate pain and other symptoms, however, the majority of treatments use medications and therapies. Which kinds of joint disorders result from unexpected trauma? Sprains and strains. Sprains and strains are among the joint conditions brought on by unexpected injuries. Sprains occur when ligaments are torn or stretched. Acute strains are caused by abrupt injuries or movements, including lifting large objects, that result in stretched or torn muscles or tendons. Joint dislocations. When bones are pulled or forced out of alignment, a joint becomes dislocated. A medical emergency is a dislocated joint. The type of injury determines the treatment. Many sports injuries can be treated at home. However, you should contact your doctor if you experience severe joint pain, swelling, or numbness, an unstable joint, a joint that isn't normal in another aspect, or pain from an old injury with increased swelling that prevents you from putting weight on it. Which kinds of joint diseases result from excessive use? The soft tissues of the joint are typically harmed by overuse injuries. They may occur as a result of overusing a joint through repetitive motions. For instance, playing a musical instrument, participating in sports, or performing certain tasks like painting or woodworking can all result in overuse injuries. Bursitis. The overuse injuries to joints are bursitis. The bursa is a little sac that is filled with fluid. It serves as a cushion between a joint's bones and the surrounding moving components, including skin, tendons, and muscles. The bursa becomes inflamed and bloated with excess fluid when someone has bursitis. The most frequent cause of bursitis is overuse, although it can also be brought on by traumas, infections, and other illnesses like arthritis. Tendinitis. When a tendon is overused, this disease develops. The joint swells and becomes painful to move. Prolonged stress. When you repeatedly perform the same movements, your muscles or tendons gradually stretch or tear, turning a strain into a chronic one. Chronic strain, tendinitis, and bursitis are frequently treated in the same way. These often involve taking medication to lessen swelling, resting, and elevating the affected joint above your heart. Along with additional treatment, your therapist might suggest mild exercise. In certain situations, your doctor might recommend a medication injection into the joint. If none of these work, surgery might be necessary. If you're enjoying this video, PLZ, subscribe my BodyTalk channel for more body insights.